Hey, good morning and welcome to Inside South Florida. I'm Dave Azer. Today, if you suffer from sleep apnea, we've got a local doctor here to tell you all about it and what some new treatments are. Plus, we have your complete social events calendar for the month of February. And there are some great plastic surgery technologies going on right here in South Florida. We're going to tell you all about them. That and more as Inside South Florida starts right now. The cases of obstructive sleep apnea in the United States appear to be on the rise. If you have it or think you might have it, you should probably get tested for it. Here's Dr. Laurence Smolley to tell you more about it and some new testing methods here in South Florida. Dr. Smolley, it is great to have you on the show. Welcome.
Thank you. It's a pleasure to be here.
All right, let's start with this. For some people who may not know, tell us exactly what sleep apnea is.
Sleep apnea is a very common problem, and it includes a blockage or an obstruction in the back of the throat at the base of the tongue, which happens during sleep. It's usually associated with snoring and a sleep disruption where a person may wake up often at night, may not wake up but have enough sleep ruination to be tired, sleepy the next day, want to nap, drink tons of caffeinated beverage in order to compensate.
And then you just don't end up sleeping the next night because you have all this caffeine and it keeps getting worse.
Well, very often the people with sleep apnea are so sleep deprived that they'll sleep under almost any circumstances.
Yeah.
So the caffeine sometimes doesn't even do the trick for them.
What are the long-term health risks of it? How serious can sleep apnea be?
Sleep apnea can be very serious, and it's well known now that sleep apnea is associated with cardiovascular consequences. There can be an increased risk of heart attacks, an increased risk of strokes, high blood pressure. Now, why is that? If you think about it, it's as if someone's trying to strangle you at night. And if someone did that during the day, you'd fight like hell. And your various stress hormones of flight and fright and fight would be turned on like adrenaline. Your heart would race, your blood pressure would go up. There are other stress hormones which affect the vascular beds. And it's a very stressful circumstance.
It's not good.
It's not good to have.
It's not good to have.
It not only affects your daytime function, but it can affect your health.
All right, so let's go over some warning signs. You did sort of touch on this already, but snoring. I mean, what are some things to look for if you have a partner who might have sleep apnea?
Well, besides this, not everyone has loud snoring. It may be subtle snoring. There could be breath-holding spells. There could be very restless sleep where the person tends to move a lot, kick a lot, may sit up choking. The other things to look for is trouble concentrating during the day. That's a more subtle problem than being sleepy. Even depression. Some patients are depressed because they're sleep deprived. You get rid of that problem with sleep and they feel better. So those are some other examples of problems.
Does it present more if someone sleeps on their back as opposed to their side?
Definitely. When you sleep on your back, you're more likely to have your tongue fall back and close the airway.
Okay. All right, so let's talk about how we treat it. And I know that there's several different sort of new methods, which is kind of why you're here to talk about these. But let's first start with at-home sleep studies.
Okay, well, you're hitting it right on the mark. Before you can treat the sleep apnea, you have to diagnose it. And more than just diagnosing it, you need to determine the nature and severity of the illness. Because depending on that nature and severity, there are different treatments that could be tailored for that. Someone who has severe sleep apnea needs nasal CPAP, which is a special device, which is basically a pump and is a hose, and then there's an interface or a mask or something that the patient wears either on the nose or covering the mouth and nose like a fighter pilot, which provides air under a pressure which keeps open the airway. That's for severe sleep apnea. And if someone has severe sleep apnea, it's a slam dunk what the person needs CPAP. In the old days, we actually did tracheostomies, where an incision would be made in the neck and a tube put in the windpipe, the trachea, to bypass the obstruction. That's rarely needed anymore because CPAP is so good. But before we go on and talk about some of the other treatment alternatives, I want to come back to your allusion to home sleep studies. Today, we have the technology to do the diagnosis of sleep apnea either in the lab, which is a supervised study all night long with a technician watching on video. There are multiple devices which record brain waves, respiratory movements, airflow at the nose and mouth, oxygen levels, electrocardiogram, even leg movements. That's done in the lab. There are a lot of wires that are controlled in a certain way, so it's relatively comfortable to sleep, and actually most people can sleep in the lab. And that's definitive. And it's very helpful for ruling out other sleep disorders. But there are cases today of patients who carefully selected do very well at home with a home sleep study. Now in our lab, we try to use what's considered a standard high-quality home sleep test with a portable monitor. That includes only a few things. It includes something that measures airflow at the nose and mouth, which is worn comfortably on the face. There's a belt on the chest and abdomen, which measures respiratory effort, something on the finger, which measures oxygen level and pulse. And from that information in selected patients, we can determine how often they're having blockages, they're making efforts to breathe against the closed airway, and we can determine whether they're severe or what. Now getting back to the treatment, if the person is less than severe and CPAP may not be necessary, even though CPAP remains an alternative because it's the gold standard, works in everybody, there are alternatives. What are the alternatives? Today, in someone who has less than severe sleep apnea, that is mild to moderate, there's something called a dental appliance or a mandibular advancement device, which is worn in the mouth during sleep, and it's custom fit by a special dentist. There's several different ones commercially available, these devices, but they have to be custom made, custom fit. They pull the jaw forward. So a person has to have healthy native teeth, healthy temporal mandibular joints so they don't get TMJ syndrome. And so this device is worn in the mouth during sleep, and over a period of time, the dentist adjusts the screw on either side of the device to pull the jaw forward.
That sounds painful, is it?
Well, it can be, and it could be annoying, and every patient's different. But a lot of patients get used to it,
right.
They tolerate it, and just a few millimeters of moving that jaw forward and opening up that space in the back of the tongue is enough. So that's a mandibular advancement device or an oral appliance. And I want to emphasize it's for selected patients who can tolerate it, have good teeth, and so on, and less than severe sleep apnea. Now the other alternative, something that was FDA approved just a couple of years ago, is I don't want to use the brand name, but it's called nasal EPAP. And what it is, it's sort of a Band-Aid type of material with a sort of a filter on it, and it could be worn on both. It has to be worn on both noses. There's two sort of Band-Aid type things that fit on the nose. The person can breathe in easily. When it's time to breathe out, there's a back pressure. There's a resistance to exhaling. There's a back pressure, much like CPAP, that keeps the back of the throat open. And some patients with less than severe sleep apnea tolerate that and do well with that. It's a minority, but some of the patients are actually doing well with that. It's $2 a night, and so there's a certain cost factor. Some insurances pay for it and some don't. Now, patients who are overweight, very important. Now, overweight is a very important part of the comprehensive care of any patient dealing with the overweight, sleep apnea particularly. If the patient is overweight, we provide specific guidelines as to how to lose weight, how to go about it to help a person. In younger people who are otherwise relatively healthy, bariatric surgery may be helpful to help them lose weight, but that's very key. Also, part of the treatment, very important, people who smoke. Smoke's not only bad for your lungs and heart, it's also bad for the upper airway. So smoking can be a risk factor for sleep apnea. Alcoholic beverages, sedative drugs, narcotic painkillers, sleeping pills, all those things can worsen sleep apnea because they cause more relaxation in the back of the throat.
Well, that's a ton of information you just dropped, and there's a ton more to say. We are out of time, but if someone has questions and wants to reach you, call you, website, whatever, how do they find you?
Well, I'm at the Cleveland Clinic, Florida, out in Weston. We're listed in all the phone books, and it's 954-659-5450.
All right, well, this was really informative. Thank you so much. And we'll see you again.
My pleasure. Okay.
Thanks. Thank you, Dr. Smolley. When we come back, your February social calendar for here in South Florida. A lot of great events going down, and we're going to tell you all about them. Stick around.